All right. Well, we'll go ahead and jump into our introductions. I want to introduce myself. My name is Megan Case. I am the statewide CarFit instructor for the Safe Mobility for Life Coalition here at the Pepper Institute on Aging and Public Policy at Florida State University. I am joined by Nicolette Castagna, and I will let her introduce herself as well.
Hi, everyone. Thank you for being here. My name's Nicolette. I'm a licensed mental health counselor, a certified dementia practitioner. I work with the Florida State University College of Medicine Department of Geriatrics and our federal grant, our GWEP grant, our Geriatric Workforce Enhancement Partnership Grant, the FSU REACH program.
Great. All right, just a little bit of background about us, the Safe Mobility for Life Coalition. We are a partnership between the Florida Department of Transportation's Traffic Engineering and Operations Office and the Pepper Institute on Aging and Public Policy at Florida State University. Together, we have formed a statewide coalition made up of 29 member organizations, all with an invested interest in the safety, access, and mobility of Florida's aging road users. And as you can see on this slide, we have a very diverse group. We have support from law enforcement, higher education, government, healthcare, and so much more. We've all come together with the shared goal of eliminating fatalities and serious injuries for Florida's aging road users while helping them to remain active and connected to their communities, whether they are driving or not, achieving true mobility independence. We believe that all of our stakeholders have a shared responsibility in aging road user safety and mobility, which is why we develop and distribute educational materials that benefit each of them and are tailored to their unique needs. Today, we're going to be focusing on the tools and resources designed to support families and caregivers and the important role that you all play in your loved one's safety and mobility. We also understand that driving safety for older adults can be an emotionally charged topic because it is often tied into feelings of autonomy and independence, which is why we have developed a brochure to do just that, to help family and friends start the conversation about safe driving concerns. This can serve as a companion piece for today's workshop because it does include a lot of the information that we're going to discuss. A quick outline of what we're going to cover today. We're going to start with some facts about older drivers, the impacts that aging has on safe driving, some warning signs in common problem areas, proactive safety measures, how to start the conversation about safe driving concerns with your loved ones, and then ultimately planning for a transition from driving when or if the time comes. You may have heard me mention the term mobility independence, but what does that mean? True mobility independence means not having to rely on a personal vehicle. It means having options. And while driving is often the easiest and the most on-demand mode of transportation, it may not always be an option, especially for those who are experiencing new or worsening medical conditions. By being proactive and exploring reliable alternatives beyond a personal vehicle, we can help our loved ones achieve mobility independence before there is a need or a crisis. But how do we do this? To help Floridians achieve mobility independence, we promote the keys to achieve safe mobility for life, which are understanding the impact aging has on driving, being proactive about safe driving skills, and ultimately planning for a safe transition from driving when it is no longer an option. We're all likely to experience a steady decline in safe driving skills as we age. certain medical conditions, such as memory loss and dementia, can exacerbate this process, which is why it is important to understand how these types of challenges can affect driving abilities. When it comes to older drivers, there is a general misconception that driving ability can be determined by a person's age, which is simply not true. What is true and what we do know is that older adults are safer drivers compared to other age groups. They are more likely to self select when they drive and avoid driving at night or during high traffic hours when risk is higher. They are less likely to engage in risky behaviors such as speeding, drinking and driving, or not wearing their seatbelt. However, they are more likely to be seriously injured or killed in traffic crashes due to age-related vulnerabilities. And that's what we're seeing in the data. The outlined blue bar represents crashes involving people 65 and older, while the red bar represents the percentage of fatalities among this age group. So as you can see, drivers 65 and older are involved in fewer crashes overall, but they're overrepresented in traffic fatalities. And that is because they are at a higher risk to suffer serious injury or death when involved in a crash as they get older. That is our primary goal at Safe Mobility for Life, to improve aging road user safety and mobility by reducing their crash and fatality rates while maintaining that connection with the community. When we consider some of the challenges that are faced by older drivers, we need to address how cognitive impairments such as dementia and Alzheimer's can affect safe driving. So I wanted to share a brief video that provides a powerful visual of what that might look like in a real world scenario.
Cognitive issues such as Alzheimer's disease or dementia can also make driving unsafe. A driver who is confused about where he is can be unpredictable to other drivers and cause dangerous situations on the road.
Just a quick video there.
So to share some stats specifically around driving and dementia, when we talk about dementia, of course, there's really a spectrum and severity of the diseases that cause symptoms of dementia, from mild cognitive impairment to more severe stages. But what we see is approximately 60% of older drivers with cognitive impairment and up to 30% of folks with a diagnosis of dementia do continue to drive. And these drivers are simply at a greater risk of crashing and being injured and causing unsafe conditions to themselves and other drivers on the road. And they are more likely to also have other health conditions, other coexisting medical conditions that affect driving abilities. So age-related changes are very individually based. But there are specific functions that are normal age-related changes for many people that decline and affect those really important skills that are needed for driving as we age. So different medical conditions that affect our vision ability, things like glaucoma or macular degeneration, um, reaction time, memory or cognition, people's flexibility or physical strength, some conditions like rheumatoid arthritis, or maybe it's an injury that has occurred. And that really affects those skills that affect people's driving abilities. Of course, how soon this happens, again, is very individualized and it varies from person to person. But it's important to be proactive and be on top of yourself, your own medical conditions, your own health, and the person that you're caring for, to understand if anything that's happening physically is going to impact safe driving skills. Oh, I wanted to also mention here that in Florida, drivers over 80 are required to pass a vision test with a doctor, and there's a specific form they have to complete. if they are renewing their license or getting their license for the first time after the age of 80. So be aware. Vision, about 90% of information needed to drive safely comes from vision and us being able to see things clearly on the road. So we do not want to normalize dementia as something that happens to all of us as we age. It is not a normal part of aging. It is a neurodegenerative condition. Different types of dementia, different types of diseases cause these symptoms. The most prominent symptom is memory loss. There can also be changes, which I think people underestimate, in the visual spatial abilities. So ability to judge where you are with distance and space and time. And that, of course, is very important with driving. Also, of course, decreased cognitive function, reaction time, judgment, and being able to understand threats and risk that are around us in a quick manner. We're less alert when people are experiencing symptoms of dementia. Driving is extremely complex, requires a lot of thinking and cognitive skills, and those are impacted by dementia. We're going to hear a little more about cognition specifically and what happens in the brain when persons are experiencing dementia from Dr. Cook here.
Hello, everyone. I just want to mention that various areas, as you can see in this figure here, various areas of the brain are involved in the cognitive perception necessary to drive, but those areas are also affected by Alzheimer's disease. So this coexistence of dementia can cause a disruption in the capabilities that you once learned as you learn driving is just natural, becomes unnatural and disrupted. So that's the difficulty that people experience and the challenges that can come with a situation when you have mild cognitive impairment or you really have an Alzheimer's disease diagnosis.
So we also know that older adults are often prescribed medications, sometimes more than they probably need to be prescribed. But it's important to be aware of what you're taking, what the person you're caring for is taking, what those side effects might be. Be aware of the side effects and the impact that the medication might have on daily function, and especially on those driving skills. Some side effects, medications might cause sleepiness, blurred vision. We hear that really quick when we hear the medication commercials on TV, all those side effects. Imagine how much that impacts your driving skills, response time, your energy levels, dizziness. So really understand the impact, especially if you're prescribed something new. Is that going to impair your driving abilities? Understand what you're being prescribed and what you're taking. Be informed, be knowledgeable, talk to your pharmacist, understand what's going on and what the side effects are of your medication. All right, so when we talk about some things to look for that might be indicators that a person is moving into the territory that perhaps they are not as safe behind the wheel. And this is really early stages when you're beginning to worry or observe things that you're questioning someone's ability or you're questioning your own ability. Look for unexplained dents and scrapes on a vehicle. Maybe someone's a little bit more confused when driving something that was always came naturally to them behind the wheel. They're not sure about like a simple traffic rule. They're getting lost or disoriented in familiar places. Of course, changes in vision. That's a really important one to be aware of and to monitor in persons you're caring for. Maybe someone always, ran up to get gas up the street and came right home and they've been gone for an hour. So what's happening there? They're taking a longer time to run a familiar errand, to do things that have been simple for them to complete. If someone is getting 2 or more traffic tickets, parking tickets, things like that. Another warning sign, a big one. If someone is not feeling comfortable behind the wheel, if you're having that little sign, that little message, listen to that instinct within yourself. People have a lot of self-awareness. We really do. So when you or the person that you're caring for is recognizing a bit of a lack of confidence and comfortability with driving, honor that within yourself. We're going to talk a lot today about other alternative driving options. That also can be a really good time to start to have the conversation with the person if they're giving you that little hint that they're not feeling quite as comfortable anymore. So when we're talking about driving skills and situations on the road, here's some areas that are a little bit more challenging for all of us, but especially areas that might be harder for someone with decline in driving skills to complete successfully. Making left turns, driving at night, merging and changing lanes, yielding to oncoming traffic, just following traffic signals or unique signs, unique traffic signs, knowing what to do at a roundabout. And of course, impaired driving, if someone is taking strong prescription medications or other types of impairment, this can be very problematic.
Thank you, Nikki. And I want to say thank you to Dr. Engelberg Cook as well for your expertise in the area. She will also be available during the question and answer session to answer any of your questions related to the neurological effects of Alzheimer's and dementia on safe driving skills.
Thank you for the invitation.
Of course. Thank you so much for being here. All right, so now that we've gone over understanding the impacts that aging has on driving, the second key to achieving safe mobility for life is being proactive about safe driving skills. In other words, what older adults can be doing now to help them continue driving safer longer, extending those safe driving abilities. Driver safety courses are a great place to start. Most of us haven't opened a driver handbook since we were 16 years old. These courses were designed for drivers 50 and older to help sharpen those safe driving skills, stay up to date on state-specific laws and regulations, new roadway improvements, and advances in vehicle technologies. AARP and AAA offer classes online and in person. And an added incentive here is that drivers who complete the course may also receive a discount on their car insurance for 3 years. We do list all of the state-approved courses on our website and in our Florida's Guide to Safe Mobility for Life, which we will go over in just a little bit. In addition to driver safety courses, AARP and AAA have driving assessment resources as well. AARP's Fitness to Drive tool is a web-based screening tool developed by the University of Florida that allows families and caregivers to identify aging drivers who are potentially at risk. As you can see, AARP has additional resources for loved ones, including their We Need to Talk seminar. So that might be a good resource if you are wanting to start that conversation or start a dialogue about any safe driving concerns. The Florida Department of Transportation and FSU's College of Medicine developed the content for the American Geriatrics Society Older Driver Safety Questionnaire. That is a mouthful. That you can answer for yourself or for a loved one. For anyone else, they'll provide you with suggestions based on your answers, which may come in handy again when you start that conversation with a loved one or their healthcare provider. Just giving you more tools in your toolbox here. Another great option to be proactive is attending a CarFit event. For those of you who are unfamiliar with the program, CarFit offers older drivers the opportunity to find out how well their personal vehicles fit them. It is a drive-through parking lot activity where a driver works with a team of trained volunteers and professionals who review a checklist of items, and that includes proper seatbelt use and fit, safe positioning of their steering wheel and their mirrors, and accessing vehicle controls. I know we mentioned earlier, older drivers are at a greater risk to be seriously injured or killed in a crash due to those age-related vulnerabilities. We want to ensure that should the unexpected happen, they are in the best possible position to be protected by their vehicle safety features. And on a deeper level, CarFit is an opportunity to, yes, share safety information, but also to start a non-threatening conversation about safe driving concerns. At most CarFit events, not all, but many, they will have an opportunity to work with an occupational therapist who can make recommendations on adaptive equipment and explore specialized services with them. Here are just a few examples of some pieces of adaptive equipment that may help to extend safe driving abilities. At a CarFit event, the occupational therapist may demonstrate these devices if appropriate and helpful for the driver. In no way are we encouraging them to go out and buy all of these devices. There's always pros and cons when it comes to aftermarket devices, especially when you're interfering with the vehicle's original equipment from the manufacturer. But I did just wanted to go over a few examples with you and just raise awareness that there are options out there. The wedge cushion on the left can help a driver who has trouble seeing over the steering wheel. Maybe they're experiencing some changes in stature or shortening and they need that extra boost. It was designed to support the weight of a person as opposed to a couch or a bed pillow, a couch cushion or a bed pillow, which we see often at CarFit events. The handy bar in the center can help a driver with limited mobility to get in and out of a vehicle. It kind of serves like the arm on an armchair to help them hoist themselves in and out. And then we see the easy reach seatbelt handle on the right. This can help a driver who may have difficulty reaching their seatbelt. Maybe that motion gives them some discomfort or difficulty. And this could be due to a chronic condition such as arthritis or limited range of motion, or even a temporary impairment, maybe a recent injury or surgery. Again, if you're weighing the pros and cons, if this device is the difference between a driver wearing their seatbelt or not, we want them to have it. Beyond driver safety courses, CarFit, and adaptive equipment, there is also the option for your loved one to get a formal driving evaluation by a certified driver rehabilitation specialist or CDRS. These usually consist of a clinical evaluation, which includes a variety of cognitive, visual, and physical assessments, as well as on-the-road testing. Some programs might use a driving simulator as part of the evaluation process, which I think is pretty neat. And based on the results, they can provide oral feedback to you or to your loved one, or even a written report with recommendations to the client, to their physician, or the Florida Department of Highway Safety and Motor Vehicles Medical Review Board. And we will go over the medical review process in just a little bit to clarify that. But this option might be beneficial for a driver who has been recently diagnosed and are in the early stages of dementia or Alzheimer's disease, because it can help them determine whether they can continue to drive safely for the time being and start to make those plans for when it is no longer an option. It's also a good idea to register your and their emergency contact information, or ECI, into the Department of Highway Safety and Motor Vehicle System. That way law enforcement can contact you, their loved ones, even across state lines in an emergency. And I think this is beneficial for everyone, not just older drivers. And last but not least, the third key to achieving safe mobility for life is planning for a safe transition from driving. There are many reasons why planning for a safe transition is important. It could be because the individual is experiencing those natural age-related changes and are feeling less confident and comfortable behind the wheel. Maybe they're experiencing new or worsening medical conditions, again, such as memory loss and dementia. You could also frame this as a cost-saving measure. Owning and maintaining a vehicle is expensive. Maybe your loved one is not driving as often or as regularly. On average, it costs nearly $9,000 annually to own and operate a vehicle in the state of Florida. It's also not a bad idea to have a backup plan in case you run into unexpected car trouble. And this applies again to anyone who drives. How are you going to get to that early morning doctor's appointment if you wake up to a dead battery? Just having a plan B can be incredibly helpful and make you feel more comfortable. Or simply for personal preference, there are so many social, economic, and health benefits to using active modes of transportation. We do encourage our audience to explore and to start using these new options now instead of waiting until a crisis happens or until there's a need. A proactive approach can make the transition smoother and less stressful if or when the time comes that your loved one is no longer able to drive.
Thank you, Megan. Such great information. So we're going to get into some tips around having the conversation around transitioning from driving. Let's face it, this is quite a hard topic, but the more that we are prepared to bring it up, we figure out the right time, we identify who the best person is to deliver the message, we practice our own ability to be effective in our communication and to keep ourselves calm, the better it's going to go. So most older drivers have not started this conversation. It's just something we avoid because of course people want to continue to be able to drive. It represents independence, but it's also it can be very dangerous when it's not safe for someone. Older drivers, 83%, a survey from the from AAA found that older drivers have not spoken with a family member or friend about their driving safety. So let this talk be a motivator to normalize those conversations and to just begin to have the discussion. It's better to start early than when, in a reactive way after an emergency occurs or after things are getting dangerous and then make it that at that time. So we want to be proactive, who to talk to. Of course, we're going to talk to the person that you're caring for, the person that's experiencing cognitive impairment. For you yourself are worried, talk to your friends and family, talk about your concerns, be aware of how you're feeling. Difficult things to talk about. We do find some relief often when we bring it up and when we say things out loud. Begin to bring in the person you're caring for, their healthcare team. They can really be an ally in this process. Many older adults very much respect their physicians or providers' input. They see them as an authority figure in this realm of driving ability. So help them, work with them, let them be your ally. What this might look like is, prior to the person you're caring for's medical appointment, call the office and share your concerns, share some factual observations that have occurred, some changes in your loved one's condition, and request that that's brought up in the appointment. We don't want to blindside their care recipient in the middle of the appointment, start talking about them in front of them with their doctor, but try to have a plan with the healthcare practice before medical appointment. So they're provider can be the one to bring it up. Get the support of your family and friends. How did they handle this with their loved ones? It might be more powerful coming from your husband's friend than you, or as an adult child, your, a beloved uncle than yourself. So think about who the message can be delivered from. That really can go a long way. What you're going to talk about. We're going to talk about warning signs. So those things that you're seeing on the vehicle, or some signs about changes in the person's abilities, and other driving options. We don't want this to be just about taking away the person's ability to drive. We need to make sure that we're replacing it with something that they agree with, that's going to help them be safe, but also maintain the ability to live their life, to be socially engaged, to have some autonomy. Okay, so I want to give a shout out to that family caregiver brochure that we brought up at the top of our presentation. That's an excellent resource that covers a lot of these tips. It can be helpful to have tips when we're preparing for what to say, but literally write out a little script before you're having the conversation. Think about a time of day when the person might be in a good mood, when there's not a lot of external stimulation or a lot of other people around. Again, let's try to not be reactive. So they come home and there's a new dent in the car. Let's not be reactive and talk about it immediately, because they're probably already feeling a little upset about that. So find the right time to bring it up. Get yourself as calm as possible beforehand. What does that take? Maybe a little bit of exercise, some herbal tea, taking some deep breaths, putting on calming music. Like, help yourself and your nervous system be calm and regulated before you're having this difficult conversation, so that nervous energy isn't coming out and making the conversation harder. We don't want to avoid these conversations just because we're feeling worried or feeling guilty. Really, those uncomfortable feelings, they do not outweigh the consequences of injury or even death that could occur if someone is continuing to drive and it's not safe for them to do so. Practice empathy, acknowledge what driving means to that person. I understand this is really hard for you. I'm going to work with you to find alternative modes of transportation, but try to involve the person as much as possible. This is not going to be a one and done conversation. It might need to happen a couple times. Probably will need to happen a couple times, but just figure out what's best for your family, what's best for the individual. You know them, you know how they like to be approached, what's the best, most effective way to communicate with them. When we're talking about iMessages, I've noticed some dents on your car, and instead of you messages and more of like a blaming tone. I read somewhere that they, recommend talking about how much more dangerous it is on the road, how much more traffic there is now, and making it more about other drivers and how concerned you are even about how unsafe the road is. So making it about other drivers might be a helpful strategy as well. So just some things about planning what to say there.
Thank you, Nikki. And that's such great advice. And we so appreciate, your experience and background that you bring to this conversation, because I think you made a lot of great points there, and I appreciate that. Touching on talking about transportation's options and how to incorporate that into your conversations with your loved ones, findarideflorida.org can be such a helpful planning tool for you, even just in preparation for that conversation. This is a resource that was developed in partnership with the University of Florida. It is an online listing of transportation service providers in all of Florida's 67 counties. It's very user-friendly. You simply type in where you are traveling from and any other relevant information, like the purpose of the trip. Is it for recreation? Is it for a medical appointment? You can also include whether the individual is 60 or older, or if they need accommodations for a disability, and you'll receive an alphabetical listing of all the available transportation options in that area. So this may include public transit and paratransit options, private service providers, and volunteer driver services as well. We do have a tip card on how to use the site, which includes the Find a Ride helpline. I was fielding these calls for a number of months, and I can tell you that probably 90% of the calls that I received were from individuals and their family members that were maybe out of state, who were seeking transportation to and from medical appointments, and they just didn't have any options. Even for you, or I, if if we just had a recent surgery or maybe an injury, or a medical condition, and we weren't able to get to that appointment, do you have a backup plan? Do you have options? So I think this is really helpful for a driver of any age. The Florida Commission for the Transportation Disadvantaged designates a community transportation coordinator for each county, and they are responsible for coordinating transportation services to individuals who are transportation disadvantaged or unable to drive or use other transportation options due to age, income, or disability. And I'm using Orange County as an example here. Access Links provides door-to-door transportation services for those who are eligible. So Access Links is the community transportation coordinator for Orange County. And every county has a similar service, but their eligibility requirements may be different. So I do encourage you to go to findarideflorida.org or call the Find a Ride helpline to learn more about those transportation services in your area. There may be travel training available. All of these options will be listed on findarideflorida.org. So please do go and check that out. This can be incredibly helpful again in having that conversation, having all of this information prepared, identifying those transportation options beforehand. And here are a few tips to help ensure a safe ride for your loved one in the case that they do choose to use public transit or paratransit services. You can create a travel kit with identification, emergency contact and destination information, a cell phone, water, a snack. Um, a medical ID bracelet can provide those assisting them with information about their health, and this may include an Alzheimer's or dementia diagnosis or other medical conditions that they may be experiencing. You may also consider enrolling them in a safe return program, which can aid in the recovery process should your loved one go missing. And I do want to mention all of this information is included in our transportation for people with memory loss brochure, which we will go over in just a minute. And I also want to mention that I know in the registration, uh, when you registered for this workshop, we mentioned that those of you who provided your mailing address would receive free resources. We will ensure that you receive this brochure in your resource bag. Before we dive into family caregiver specific resources, I just want to briefly highlight some additional tools to help create that transportation plan. Here we have our tips on how to use transportation options in Florida series, which covers active modes like walking, biking, and public transit, as well as some niche options like transportation network companies, Uber, Lyft, and golf carts. These how-to guides explain the benefits, they provide practical tips, and help users to feel more comfortable using alternative transportation options to get around their communities. We also have the Florida's Guide to Safe Mobility for Life, which I mentioned earlier. And this is our one-stop shop with everything needed to develop a transportation plan and put that plan into action. It has an entire section on statewide and county resources, and that includes your area agency on aging, the community transportation coordinator in your county, transit agencies, memory disorder clinics, and driver's license and tax collector offices. We wanted to make sure that we had all of those resources in one place. This is available in English and Spanish as a hard copy, ebook, or PDF. All right, I'm going to hand it back over to Nicolette to jump into those resources that were developed specifically for families and caregivers.
So we're going to talk about first going to, again, highlight some of the excellent materials that the Safe Mobility for Life Coalition has. SafeMobilityFlorida.com. There is a webpage, dedicated exclusively to family and caregiver resources. It outlines the process around how to report an unsafe driver and that Florida Department of Highway and Safety Motor Vehicles process. There's information around dementia and alternative transportation options. We make sure to link users to the Department of Elder Affairs and some of the publicly funded state programs to support families caring for someone with Alzheimer's, the Florida Alzheimer's Disease Initiative. The Silver Alert program is highlighted there. Those are dementia-friendly transportation brochures to help transportation providers be trained, but to also help families continue, if you're going to continue to allow your loved one to get out and utilize transportation services, how to do that safely so they can continue to participate, but stay safe. The Elder Helpline is also included on that webpage. It's a very important number. This will connect you to your region's area agency on aging and get you connected to resources. So be aware of this number. It's a very important one. Oh, to go back for a second, I wanted to also highlight there's some great materials. I think there's a lot of professionals here in the house, a lot of social workers and people from different organizations like memory disorder clinics. We have healthcare practitioner toolkits. Because while we like to try to rely on healthcare providers to be the ones to have this conversation, not all of them are comfortable doing so, and not all of them have great training and dialogue prepared of how to break this news to their patients. So healthcare practitioner toolkits are available. It's a great resource for healthcare professionals across the state to help them better educate their older patients on how to be safe drivers, planning for transitioning from driving, and how to use other transportation options. So the coalition's happy to send those to your practice. Mention it to your doctor. There's healthcare practitioner toolkits. Again, there's some great resources out there for all different types of laypersons and professionals. Alexandra with the ADRC is going to tell us a bit about her organization now.
Hi, thank you, Nicolette. Okay, the Alzheimer's and Dementia Resource Center is the ADRC here in Central Florida. We provide local resources to family caregivers, the care partners going through this journey with their loved one, difficult journey. We have support groups that are virtual and also in person. We have skill building workshops and series pertaining to any topics memory issues regarding memory issues. We have also the one-on-one care coaching. If you have a crisis in your family, you have agitation, disturbances, and you don't know how to communicate with your person living with memory issues, we are here to listen and to give you the tools and techniques of how to ease the conversation, how to communicate with them, and how to live with them a little bit with less stress. We also have Informed Aging podcast. It's free podcast that you can download on your phone, the app, and listen to all the different professionals throughout the United States and even Germany we had, that will give you tools and technique or talk about different subjects like elder law or neurodegenerative disorders, et cetera, et cetera. So you will have a lot of different topics in the Informed Aging podcast. We also have a little free library, even if you can just pass by the office and you don't need to get in, open the library, and we have free books for you pertaining to dementia, to Alzheimer's disease, to Lewy body dementia, vascular, whatever you need, information you need, and also how to help you, the caregiver, help a person living with dementia or care for a person living with dementia. And also, we are the state of Florida Brain Bank for Central Florida. We cover 21 counties and for the brain bank, and in partnership with Mount Sinai Medical Center and also Mayo Clinic. And Mayo Clinic is the entity that does the autopsy, and they will provide a neuropathology report so that we can share with families and doctors who are following your loved one. And it's a free program as well. We have our number here. We also have a music box initiative where we provide a kit with at least 5 instruments so you can interact with your person living with memory issues, and that will help with movement. And you know how music affect the brain positively, and you will see positive attitude, positive change with your person, and they will enjoy music. So this is our main line, which is 407-436-7750. Our website is here, our location, and you can contact us and we'll be more than happy to assist you with resources. And it's not only for Central Florida, the resources we provide that throughout the United States and the state of Florida. Thank you.
Okay, so we're going to get into the how to report a medically at-risk driver. This is a last resort. This is not something people want to have to do, but for some, sometimes it is a necessary step. So this is the on the screen here. We have the medical review form from the Florida Highway Safety and Motor Vehicle Department. These forms can be completed by a family member or caregiver. You are authorized to report a medically at-risk driver. The process takes a bit more time if that is the case. Typically, it's filed from a physician, a person, or maybe a law enforcement officer about a driver's medical conditions or symptoms that could affect safe driving. It's not about someone being over 90 or like a specific age. This is confidential information. There's no legal action that can be taken against someone submitting the report. Once the report is submitted, there is a Florida Medical Advisory Board. And they provide the agency with the final recommendations after reviewing the person the form submitted for, after reviewing physician evaluation, medical information that's submitted, supplemental information that's submitted to help them determine the process. So we thought this little flow chart might make it a little bit easier to understand. So basically what happens, the form is submitted, a medical report needs to be included from their doctor for review by the medical advisory board, or sometimes people are just requested to take a test, to take a vision test, a written test, or actually pass a driving test. Of course, if someone passes, their driver's license is reinstated. If not passed, they might need more additional medical information. If they pass that, if it's maybe like a temporary condition, their license still can be reinstated. If not passed, the person's license is revoked. So for more information, this process is detailed on the Florida Highway Safety and Motor Vehicles.gov and the medical review process. Another thing we want people to be aware of, which I'm sure many of us have seen when we're on the highway, it's definitely a sad thing when we see these notices. But the silver alert is in place in Florida to help law enforcement find adults with cognitive impairment and return them home safely when they're lost. There's local silver alerts. Some local jurisdictions have silver alerts for people missing on foot. Typically, this is a process for people that are missing behind the wheel of a car, which someone can get very far very quickly. So if you find that the person that you're caring for has gone missing and missing in their vehicle, please call 911. Do not wait. Maybe spend a little bit of time, 10 minutes or so, looking around, figuring out where they are, trying to figure out where they are on your own. But it's very important to call and get the authorities and get resources available to try to find them as quick as possible. This is a standardized and coordinated community response, and it can find people very quickly to make sure they're returned home safely. The coalition has a really great silver alert work group that's been trying to understand the process, who does what, and help prevent these from continuing to happen, to help connect people that have experienced a silver alert, get referred to organizations that can help keep them safe, provide them with the care and support that they need. But please don't wait. It's something that sometimes people might blame themselves, or of course it is a very scary situation. But set that guilt aside. We got to go ahead and call 911 to try to make sure the person is recovered safely. We've talked a bit about these materials. This is something that our program with FSU Geriatrics has collaborated with the coalition on to create some training materials for families and care partners in Florida that are helping their loved one use transportation services. So some ways to be proactive to help them remain safe while they are accessing transportation services. And then we're also undergoing a process to train transportation providers around how to better serve passengers living with dementia. We do have a print resource available now, and we are working on expanding that training program. So yeah, we're just excited to share this. These are available for you. Let us know if you want us to mail you some for your organization or just for you personally and your family. You can find them online, or we can send you print copies. Okay, so I see we're approaching the 11 o'clock hour, but lucky for you all, we're going till 11:30, so we have plenty of time for questions. But we are winding down our slides. I know this is quite a lot of information, but we want to be as thorough as possible. It's trying to strike a balance between safety and empowerment to continue to still drive if that's applicable for somebody. But while we're focusing on family caregiver resources, I want to give a shout out to the Family Caregiver Alliance. This is a national group. They have such an amazing website. There's a section on tips for caring for your loved one, specific medical conditions that they have and skills needed to address the needs of those medical conditions. There's also a great section around just caring for yourself as a family caregiver and some of the unique challenges that arise when we are in this role. They have a great section on dementia and driving that covers a lot of the tips that we've talked about today. That was a great resource for the content that I provided you all, so check out that website. Canada, the Driving and Dementia Roadmap is also a great website. Check that out. And UCLA for all types of scenarios that come up, all types of behavioral symptoms of dementia, and different unique life challenges that come up when caring for someone with dementia. They have these awesome training videos. There's probably 20 different ones on topics around refusal to bathe, aggression, repetitive questioning, those things that occur that are quite difficult. But they have one around driving. There's a little interview with someone explaining what happened with his mom caring for her when they were undergoing the process of trying to get her to stop driving. So just good resources for you. Education is power. Check this stuff out on your own time. And yeah, we hope you find it helpful. So just to recap the specifics around for those of you in the audience that are caring for someone with dementia, what we want to do first, we want to be proactive. We want to monitor the driving of our loved ones. Consider the warning signs. What are some things that you're seeing? Dents in the vehicle? Did they get a parking ticket or speeding ticket? Are there some physical changes that are occurring? Are you finding their memory to have worsened? Be vigilant about those warning signs that can really start to show us that is not safe for someone to drive. One of my geriatrician colleagues told me to please discourage people from being a co-pilot to their loved one. We hear this a lot. Well, my wife can still drive as long as I'm in the car with her and I'm helping her. If she can't drive in the car by herself, it's probably not safe for her to be driving at all. So we discourage this as a way to prolong your loved one to drive. In the early stages, it's probably useful to be a passenger to monitor their driving skills, but for it to be a long-term plan to serve as a co-pilot or supporter, we really don't recommend that approach. Please be aware of medications that might impair driving skills, especially if it's something new, especially if your loved one is prescribed a lot of different medications that might be interacting with each other. Just be aware of physical health related changes and medication side effects. Begin to limit driving. A lot of people do end up doing this. They kind of self-select out of more dangerous times to drive. Avoid nighttime driving. Don't get in the car if it's raining. Avoid unfamiliar roads. That can be really important. And when you see someone naturally cutting back, reinforce that. Hey, I see you're being safe. You're not driving at night anymore. That's great. Try to plan family gatherings or schedules for daytime activities. You know, if someone's trying to leave an event before nightfall, don't try to get them to stay later until dark if they're trying to leave because they feel it's safer for them to leave and drive while it's still light out. You know, try to reinforce and support those safer driving skills, and they're limiting their driving a little bit. We want to have these conversations about driving, normalize the conversations. Maybe you ask about when hey, when did granddad stop driving? You know, ask about what their parents went through to stop the driving process. Reduce the need to drive. Get a process going where their friend starts picking them up for card games at the senior center, and that just kind of becomes the routine. It's sort of organically removing their need to drive. Start using delivery services. There's one thing that came out of COVID is there's a lot more options for people to get things delivered to their home. Explore other transportation options. We talked about those transportation network companies like Uber and Lyft. Well, yes, they are a bit more expensive than our public transportation agencies. They can help with accessibility. You can call and request an Uber for someone else. I often do that for my grandparents, and they have a new friend pick them up outside their door without them having to do anything themselves. There is a 1-800 number now that Uber has provided, so you don't have to have a smartphone and a formalized Uber account that way to call and request a drive. There's a 1-800 number to make it a little more accessible for people. So just begin exploring these options for reducing the need to drive. So that's a bit of a recap of what we've covered today. We have just one more slide around some things that you can do now. Start the conversation early. Please order materials that we've discussed from the Safe Mobility for Life Coalition's Resource Center. Their team members have been super helpful today, putting a lot of information in the chat. So review the chat, click on the links, get access to this stuff. The coalition has a newsletter that comes out with really helpful articles and links to information. Follow the coalition on social media, and also challenge yourself to explore other options. Check out your public transportation. Figure out how to carpool with people, how to get a ride from somebody else. Start exploring other options. All right. Thank y'all for your attention throughout this time. We have plenty of time left for question and answers, so we look forward to hearing from y'all. I know there's some great professionals that do a lot of work with family caregivers and older adults in the audience. If there's something we miss, like, feel free to kind of share your perspective and wisdom as well. But we would love to answer any questions you have at this time.
Thank you so much, Nikki. That actually timed out really well, and I hope that you all will feel free to share your comments and questions.
Hey, my name's Stephanie Hartsfield. I'm the program coordinator for Safe Mobility for Life. So I've been popping those chat links in. Brandon just re-popped in that PDF, which we did develop so that you don't have to scramble. It should have everything that we talked about. I know somebody mentioned wanting the slides, so we're going to work on getting a PDF of those to whomever would like that. There's also on that PDF, there is a survey that we would love for you to take, because we want to continue to, provide this resource and continue to learn and grow from our audiences. So I'm going to pop that in the chat as well. It's also on that PDF. We definitely want to hear back from you on what you liked, what you didn't, what we could be improving upon. And we could hope to continue to do these types of workshops in the future. And I hope we got to everybody's questions. Gail and I were in the background. Definitely a lot of people out of state. We actually, our program manager is on a national group where other states are trying to pick up and do more resources similar to what Florida's doing. So we will definitely look into any of those options that we can find. Get back with you. We have everybody's contact, fortunately, so we can follow up as needed. I think there was one question I didn't know the answer to, but I can assume is liability for a family or caregiver of somebody with Alzheimer's who continues to drive. If they get into an accident, I assume there is no liability for the family, but that sounds kind of like a case law thing, so I wouldn't even be comfortable answering that. But we did share the reporting process as an avenue.
But you do have some lawyers that will be
I might try.
more than happy to say that the family knew that the person had memory issues and they let them go. Even if it's involuntary manslaughter, they may go after you. So you have to be careful. Make sure that you talk to the doctors, like we mentioned, Nicolette and Megan mentioned, and also have the advice of an elder law attorney. Make sure you have your durable power of attorney papers. It's not when the person is not able to make a decision or doesn't have any judgment, cannot make any judgment call anymore, that you need to go and have the advice of the elder law attorney. Be proactive. Because if the person, your loved one has memory issues and cannot make decision, you can no longer be a durable power of attorney. You will have to file for guardianship, and guardianship is very, very expensive. So make sure you do all your paperwork before your healthcare surrogate. You can make decisions, and then talk to the doctors, so you're not the bad guys bringing the situation up front, but have the chat like Nicolette mentioned. Try to have a family member ask, how did your grandparent, were no longer able to drive. So it's very delicate conversation, but you make sure that you have the advice of an elder law attorney. And also, you are not alone. You know, you have us, you have FSU, you have the Department of Transportation, you have a lot of different resources in the community. So if you don't know, the Elder Helpline can assist. And also, in the state of Florida, we have the HCBS programs, which is the Home and Community-Based Services, where you can apply for daycare assistance. You can apply for assistance at home, or if you're no longer able to pay for, you're not able to pay for assisted living facility. So you have different programs that can assist the caregivers, and they have a priority list. It's not like you apply and you will get them immediately. So it's good to have a care coaching with somebody, or call someone. If you call me again or you call somebody, I'm sure they will give you at least a number. So if we cannot help you, we will give you some resources.
Yes, Alexandra, I did want, just off of what you were saying, I did receive a question in the registration from someone who was inquiring about adult daycare services. And so what would be or activities that are going on during the day in someone's area, what would be the best, would the elder care helpline be the best number to call in
Yes,
that case for that type of question?
Yes, definitely the 1-800-96-ELDER, which is 1-800-963-5337. That's the Elder Helpline. They are the Elder Helpline run by the Area Agency on Aging and Disability Resource Center through the state of Florida. We have 11 Area Agency on Aging that covers several counties, each of them. And it will be your best bet to apply for adult daycare, like Megan said, and it's through the ADI program that you can get some respite. If it's several times a week, or if you need Monday to Friday because you're working, or you need to take a break. And you cannot say you don't need to take a break with this illness. You have to take a break. Otherwise, you will develop yourself, stress, depression, etc. So it's important that when you call, that you are able to inform them, yes, there was a diagnosis, and the person was diagnosed with dementia, or with some form of dementia, if it's Alzheimer's or vascular, etc. And they'll be able to schedule for an assessment to be done. And it's not in your home, it will be over the phone. That's the first assessment. And they will place your loved one on a priority list to see which program will fit best your need. And it can be daycare, it can be help also at home with bathing, cleaning, home delivered meals, etc. Or it can be out-home respite care, So depending of what your needs are and your financial eligibility, they'll be able to guide you. That's a great question, Megan.
That's great. That's great advice. And you bring up such a good point, Alexandra, to make sure that as caregivers that you're taking care of yourselves as well, of course I can't think of it now, but putting on your oxygen mask first before helping others, making sure that you're taking care of yourself and getting that rest and respite that you need to be the best caregiver that you can be.
Yes, I've actually taken Nicolette's caregiver course, and it's wonderful on how to maintain. And if you don't mind me plugging one more thing, somebody mentioned promoting phone numbers. I did want to mention we do have a toll-free number for our resource center. All of our resources are in print, and we have somebody to help, which is Brandon, if you do need to call and find out what works for you. Also, Find a Ride has a helpline. I did put them in the chat if you scroll up a little bit. Our tip cards also promote all the phone numbers, and we know that tangible print materials and a live person to speak to are definitely the way our audience likes to, get resources. So we make sure, like Megan said, we all field these calls for Find a Ride and for people looking for resources. So we've all had that experience and know how helpful it can be. And anybody who's working in the professional capacity here, we do have a community partner program. I did put a link in. We're trying to grow our network essentially. So we also offer training on this demographic, people, other organizations that are dealing with older adults could be learning a little bit more about the sensitive conversation, how to get somebody to listen to the topic of driving and safety. We also have great toolkits and resources. We are a statewide coalition. We try to get around the entire state, but a good chunk of us are up here in the freezing cold Tallahassee Panhandle area. So the more partners we have, the more we can reach the entire state. And so definitely take a look at that as well. And if it looks like a good fit, we try not to, ask too much of our partners. We just want to know who you are and then how can we continue to have this relationship moving forward.
Can y'all show the survey on the screen so we can get people to take the evaluation survey?
Sure, let me pop it back in the chat so Megan can.
I think there's a link on.
Yeah, we're having a good conversation in the chat, so it's slowly getting like pushed to the top. I'll pop it in one more time.
We have we're going to post the link in the chat. It will be in the PDF, the workshop packet that I'm going to send out in my follow-up email, and I will also include the link directly in the email to that survey because we really do value your feedback and we would love to hear from you on what you found to be helpful and useful. And maybe what you did not, because we're always trying to improve this workshop. We're here to support you in this journey. So thank you all so much for being here. Was that all the questions that we
I believe
had?
so.
Okay.
If you did not hear back from one of us in the chat, you can always unmute yourself too. Now we have more time if anybody wants to stick around. But I just, a testament to your well-covered presentation, I feel like. So
I would certainly like to thank you all for all this information that you all have supplied us today. I'm V. Armand from the Orange County Sheriff's Office.
Hi, V.
I am the senior. Hi, how you doing, Alexandra? A very nice. All the support that you all have given, all this information is very well needed. One thing I'd like to say about the Silver Alert program is it's very, very helpful because we are able to help relocate the individual also by the people calling in that sees the Silver Alert sign and gets the description of the vehicle and provide the description of the lost loved one and to law enforcement. So we are able to use the public to help relocate these individuals and help them get safely back home. It's a very, very rewarding program, and that's one of the things I'm very happy to see you all have on this program as well. Also, the CARFID program, we have a specialist from the Sheriff's Office here as well, Community Relations, and she does an excellent job with that, creating these parking lot events where people can get fit for their car. We did it with the Senior Academy. We do it with Senior Connect. I mean, it's a good way to reach out and let the seniors know whether they have a cognitive disease or not, how to be safe and driving and whatever tools they need. So I have been very much informed by this program, and I'm so grateful that you all have put it on today and provided all this information. Thank you so much.
Thank
And,
you.
am I on?
yeah, I was actually want to introduce Christine's actually one of our community partners, and she asked if she could talk a little bit about their Plays with a Purpose, which I actually think is really cool.
Yeah, thank you so much. I mean, we just love what you put out, and we put it out for our folks. So SAGES stands for Senior Actors Guild and Education Services, and we're a 501c3 nonprofit as well. And we service the Pinellas County area primarily right now. Been in the Tampa Bay wide area, but our plays are on topics people don't like to talk about, as I put in the chat. We started off with fall prevention, and then we went to stopping scams. And then we introduced Dealmaker, which is all about a grandfather who does not want to stop driving and keeps making deals with everyone who finds out these different things that are happening, so that they don't tell his son. And so Dealmaker is a great play. Our plays are an hour long. They are free to the public. That's why we're a nonprofit. That's our mission. And all the roles are performed by seniors. Most of our volunteers are over the age of 50, but certainly in that play we have those that are primarily all the roles are focused on those over 65, except for the teenage granddaughter, which is a wonderful addition to have in there because she's a catalyst for change. But what I wanted to tell you is, as well as partnering with Safe Mobility, we partner with AARP, which of course supports your CarFit program and does those all around. And in our partnership with AARP Florida, I have given them a recording of Dealmaker that they can, share so that people know what it's about. And I'm happy to share that with you guys. In order for you to actually use it where you live, you have to license it. And I can give you all of that information. But I think you would enjoy the fact that it's a real, truth on stage, real stories, real seniors acting this out for their peers. And the result is they just, the audience responds and is able to talk about these issues more freely. It's funny. It has a lot of humor, which is all written by our 78-year-old playwright who definitely knows her audience. And, we enjoy it. And we did get a little exposure this year about one of our plays on national TV. So we're hoping that this one will also grow, and certainly partnering with you guys and AARP is our intention to get this out into communities everywhere so that people can, embrace this topic and talking about it differently from just reading materials or listening to a lecture. We do include the community partners, Florida Highway Patrol and, local law enforcement. They speak after our shows. So there's a lot of opportunities for you to do some different and great events by using the kit, which is only $350 that just supports our services and putting it together. So we want to make this affordable and accessible and easy for all. So we're happy to be part of your community partner team.
Thank you. And
That's
there was
such
actually I was going to mention there were some other great questions that have popped up that I wanted to get to because I don't know the answers to them. Somebody mentions that they are a part of the sandwich generation, which is those both helping with grandkids and their own parents, and wondering what type of support is for those unique individuals.
Well, like we said, we mentioned first step, call the elder helpline to find out what you can, what the state can do for you. Because we do have in the state of Florida programs under the general revenue, such as CCE, the Community Care for the Elderly, sliding scale fee. Also, they have the HCE program. That's a stipend that they can provide to the caregiver if the person living with memory issues is living with you, or if it's an older adult with no memory issues but has physical limitation that you're caring for. And if they do qualify for the state Medicaid managed care long-term care program, I know it's a long name, okay, long-term care program, which is through Medicaid, there is a program under that umbrella called PDO, which is the Participant Directed Care Option. So if the person qualified for that program, and you don't want any home health agency or strangers come to the home, during 2 months, the state will provide, your managed care organization will provide services. They will do the level of care, and they will see how much it will cost. And for example, if it will cost the state $1,800 under that program, they will provide that to the durable power of attorney, and that durable power of attorney can hire anyone in their family or neighbors or anyone they trust to care for their person living with memory issues, or the elderly person having medical issues and needing help. It's not only for the elderly under the state Medicaid managed care long-term care program. If you're 18 and over with disability, you can qualify. Like I said, they have asset requirements, and they do have also physical requirements, mental requirements, and there is a priority list for that. They don't want to call it a waiting list, but it's a priority list because it will generate a priority score. So, and call 211 as well to see what do they have for you. And probably if you're caring for two people, you're spending money, you have EHE program that can help with, or the LIHEAP program that can help with electric bill, or in your county, you may have an organization or the county government that could help you with rent, maybe once in a while. You just have to look at your county requirement and reach out to them and find out who can help you this month, because you are taking care of a person, but they do have to see that you're working, or if the elderly is in your home in order for them to help you with those type of assistance. It depends on what program you will apply for. That's a great question.
I did find
Thank you,
ARP does promote some grand facts and grand family resources too.
So there's a program if you're caring for grandchildren, like more in a parental capacity, there's a program called GAP, Grandparents as Parents. So depending on your unique family situation, that might be applicable to you. And that's kind of what Stephanie was just referring to, is more of those grand families. But in general, any form of self-care prioritization for yourself when you have such a big caregiving role, caring for your adult children, their children, and your parents, it can be quite a lot. So find caregiver support programs. There's support groups. There are programs like T-Care. I'm going to pop in the chat that our region's area agency on aging has begun to connect caregivers to. That's an online platform to prevent caregiver burnout. Find strategies to take care of yourself. Find little breaks. What are things that rejuvenate you? Learn some stress management strategies, little exercises to keep yourself grounded and feeling okay, despite all the competing roles that you might have in your life. But yeah, so thanks. Hopefully we answered your question. Maybe we answered it too in depth. Alexandra knows her stuff with all these programs. Thank you for explaining that, Alexandra. It can be quite complicated to know what we qualify for and what's available.
Thank you.
It's so nice having all of the experts here in one place. And I love the idea of the plays with purpose, bringing some levity and relatability to what otherwise may have been, a tense,
Yeah,
difficult topic to
I was gonna
broach.
say, I know your mentor, Fran Carlin Rogers, has attended one, and she spoke very highly of them. And she's another statewide CarFit instructor, and she brought us, and they've actually been on the Coalition for a Community Partner for a while now, and it's really nice to re-engage. And so I look forward to hearing more.
Thank you.
I just want to say something for everybody. I'm Gail Hawley. I am the program manager for Safe Mobility for Life at the Florida Department of Transportation. And I just want to say that I'm blown away. I work with this team, on a daily basis, and I'm continue to learn something new. I think everybody did a great job. And Alexandra, I really appreciate you connecting us with this audience, and you, all you family caregivers and those who work with them. I just thank you for, for attending, for, providing us good feedback. And, we really want to make sure that we provide resources that can help everyone. So, so just wanted to just say that little thank you. It's
Yay.
perfect.